Welcome to Optimal Health Miami Web TV. And today we have Dr. Marc Gittelman, who is my doctor, your doctor, everyone's doctor, who helps answer our questions that we all have. How are you doing, Dr. Gittelman?
Great, Jenny. Happy to be here. I think we have so much to teach our viewers, and we'll get started today.
Absolutely. And we have a wonderful, interesting topic, right?
Yes, we do.
Erectile dysfunction. So tell me a little bit more about, first of all, what is ED? Because I hear everybody talking about ED. My husband has a problem with ED. What is erectile dysfunction?
So the point of erectile dysfunction is that it's not an all or none type of situation. It's not as though somebody wakes up, the guy wakes up, and one day he doesn't have an erection. There's actually a full spectrum, really, of becoming dysfunctional, if you will. So it starts off where men no longer can continue the lovemaking with a full hard erection. It sort of gets soft toward the end. And over the years, it gets harder and harder to maintain that erection. And eventually, they can't even have vaginal penetration.
So let me ask you this question. Around what age, or is there an age, that usually you see your patients, men obviously, who start developing ED or erectile dysfunction? 20s, 30s, 40s, 50s? At what age?
So while the average age is about 55, I will see literally young men in their 20s who are critical of their erections. They have problems. Yeah, it's really...
That seems very young.
It is young, but the younger patients really have different issues.
Okay.
For them, it may be about performance anxiety. It may be difficult with new situations, new loves in their life, if you will. But as men age, the blood flow and their hormones change, and it becomes way more challenging to have a good erection.
So younger, you're talking about maybe more psychological issues that cause ED, but as you're older, it's obviously something physiological where hormones come into play.
Absolutely, and that's where we get the term performance anxiety. It's those men that are in new situations, or even really young men, even young couples that can have that problem.
Oh, interesting. And now I know that there's so many different pills out there, out on the market. You have Viagra, you have Cialis?
That's correct.
And obviously he would know, folks, because he is one of the lead researchers, I know he's humble, in helping develop these amazing medications. I mean, I'm just honored sitting here next to you. So, but I know that there's so many different types. What is the difference between all of them? I mean, do they all work the same? Can you explain to us a little bit?
So, first of all, thank you for those kind words. Yes, we did have the opportunity to help develop virtually all of the medications on the market, from Viagra, which amazing now has been on the market since 1998. And then there was Levitra, Cialis, there's Staxin and Stendra. They all have different flavors, if you will, but they all really work the same way, is to increase blood flow to the penis for a more firm, longer-lasting erection.
Okay, so besides, obviously they all cause the same thing. The end result is the same. But is there a difference as far as, because I've heard, and I don't know which is which, because that's why I'm asking these questions, but I've heard that there's certain types of medications that you can take within half an hour, and the effects are immediate. But then there's some that take a longer time to work. Why would somebody choose one over the other? What is the difference? It's overwhelming. There's so many. I don't know.
It is. And I think there really is a lot of confusion out there. There really are sort of three categories of these medicines. There are the fast-acting medications. There are the longer-lasting that we hear advertising that they can last as long as 12, 24, 36 hours. And then there are medicines you literally can take like a vitamin so that you never have to think about it. You're sort of daily pill and you're ready to go. So they're all different, and each patient has different needs.
So what would you recommend, for instance, somebody who is in a marriage, who is in a long-term relationship? What would be the pill for that particular individual?
For a patient in a long-term relationship, or a man in a long-term relationship.
A man, of course.
For a man in a long-term relationship, they really almost always know about when they're going to be sexually active. So for them, they might know it's Saturday morning, it's Friday night, it's maybe even if it's every day, but they can kind of plan it out. For them, it's more likely and makes more sense for them to just use a medicine we call on-demand. They know it's going to work within an hour or 2 hours of when they take it.
Which one is that one out of the ones that we know of?
So Viagra is the one that works within about an hour. Okay. Believe it or not, Staxin and Stendra, one of those is a melt in mouth. actually will work within 15 minutes. So for those sort of emergency moments, if you have the right brand and you're sort of ready, then those are
you just pop that one in and you're ready to go.
Exactly. So more for the spontaneous crowd, if you will.
Interesting. And how long do they usually last, the erection, when you take these?
So the erections are spontaneous. Those erections will last what they are supposed to last. In other words, it's the context of your lovemaking. They're in your system anywhere from 5 hours or 6 hours for Viagra to 36 hours with Cialis.
Wow.
But that doesn't mean it's a 36-hour erection or a 5-hour erection. And I know many of you may be thinking, what's wrong with that? But it's really probably not an ideal situation for either partner.
No, that is so amazing. I think this is such a valuable information. I think a lot of people, well, like me, you hear about, the little magic pill, right, as they call it, but we really don't understand how it works. And I didn't know that based on your lifestyle, there's just different types of medications or pills that you can take to fit your lifestyle. And that there is actually a solution to, obviously the concern of erectile dysfunction. I know that you treat patients in your practice with ED. Can you tell us a little bit more about maybe the procedure of what your patient goes through?
Sure. I think the hardest part, Jenny, is really for the men to come in and say, hey, I have erectile dysfunction, I have ED. It really takes a while for them to get to that place. Sure. But once they walk in, we talk with them, really understand better what's happening. Is it an issue of hormone imbalance? Is it an issue of hormone imbalance? Is it an issue of blood flow? And we really have very simple testing that we take them through so that we know exactly what's going on with that individual man.
That sounds amazing. Thank you so much, Dr. Marc Gittelman. This has been a very, very informative session. I can't wait for the other topics that are coming up soon.
Thank you, Jenny. There's really so much to learn and so much to teach. I really look forward to continuing our web series. Thank you for dropping in, and until next time, I'm Dr. Marc Gittelman of Optimal Health Miami, and I'm wishing you a week of optimal health.